According to a study on COVID-19 patients published in American Medical Association Journal, the total death rate of 44,672 COVID-19 patients was 2.3%, but 8.0% in 70s and 14.8% in 80s and older. Especially for patients with diabetes, the death rate was 7.3%, which was higher than that of all patients. In addition, when several studies analyzed the underlying diseases of patients who died of COVID-19, it was found that many cases suffer from diabetes and its complications, such as high blood pressure, diabetes, and chronic kidney disease. 1. Higher death rate for COVID-19 patients with chronic diseases. Elderly diabetics are at high risk for death from COVID-19 infection. In addition, if you have diabetes, your immunity is lower than that of a normal person, because the functions of T-Cell and Neutrophil, which are important functions of the immune system, decrease. When blood sugar is high, important elements of the innate immune system, such as neutrophil and macrophage chemotaxis, and phagocytosis, become impaired, making it easier to progress to secondary infection. In addition, severe viral infection causes cytokine overload, but with diabetes, the concentration of cytokines further increases, leading to endothelial cell dysfunction and complications, which increases the risk. 2. Check your blood sugar more thoroughly twice a day. People with diabetes should be aware that they are more likely to develop serious illness than people who do not, and should follow thorough prevention rules. Taking diabetes medicines and taking insulin more thoroughly than usual, blood sugar monitoring and strict management of lifestyle are very important. You should check your self-blood glucose readings at least 2 times a day, once in the morning and at least 2 hours after meals. If the results of your own blood sugar measurement are consistently higher than usual, it is recommended to visit a hospital and see the doctor. If a diabetic patient has a sudden rise in blood sugar and persists, or has typical diabetic symptoms such as polyuria or weight loss, you should go to the hospital unconditionally. In addition, if you are accompanied by suspected symptoms of COVID-19, such as a cough or sputum fever, you must notify the quarantine authorities in advance that you are diabetic in order to respond appropriately. 3. Even if it is difficult to go out, indoor exercise for at least 30 minutes every day is required. Diabetics, as well as family members living with diabetics at home, should refrain from going out or visiting other areas. Hand washing and coughing etiquette must be followed at all times. Be careful not to touch your eyes, nose or mouth with unwashed hands. Visits to crowded places should be avoided, and masks should be worn if visits are unavoidable. Even in the home, personal contact should be avoided as much as possible, and places that are touched a lot, such as on the table, door handles, and keyboards, should always be cleaned. Meals should be limited to simple sugars, but should be done regularly, 3 meals a day, and intake of nutrients evenly. It's a good idea to eat plenty of fresh vegetables and moderate protein. Drink enough water to prevent infection. Exercise is essential to maintain immunity. It is a difficult time to go outside, so we recommend that you do aerobic exercise for at least 30 minutes every day. Even at home, indoor biking and treadmills are recommended. In addition, doing exercises to strengthen lower body muscles, such as squats, at least twice a week can help protect personal immunity.